There's no criteria. So a normal diagnosis, tick mark, tick mark, tick mark, tick mark, you know what I mean? And okay, here we go, we're gonna prescribe you this safe supply. No, it doesn't work that way.
The need for a clean drug supply should be pushed on every level of government. That's the message from a frontline worker on the Downtown Eastside, who feels right now there's preferential treatment being given when it comes to who lives and who dies.
I'm going to get emotional.
Ellie Taylor found herself homeless at just 14 years old. She has struggled with drug addiction and come out the other side. Now Taylor is fighting for those still dealing with their addictions and worries the supply has become increasingly dangerous since the pandemic.
Every kind of substance in there as filler, and it's dropping people dead because that's not responding to the Narcans, even the new Narcans for the other substances.
Last week, Andy Watson with the BC Coroner's Service announced we have now passed our 2019 year total of illicit drug toxicity deaths in just 8 months. Last year saw 983 deaths, and so far 2020 has recorded 1,068.
One of the things that's coming through in the postmortem testing is that we're seeing high toxicity levels. So basically, what would be considered a lethal or an extreme level of fentanyl detect. And normally we see something kind of 5 to 10% range, certainly in previous months. What we've seen since the start of the COVID-19 pandemic amidst dual health emergency are numbers closer to 15%.
Earlier this year, the provincial government announced safe prescription drugs can be provided to people who use substances. But Taylor feels physicians have too much discretion when it comes to who is given a prescription and who is not.
Doctors could decide not to give you a substance that could save your life. So what this means is instead of like with cancer or diabetes, where I go in and I'm given a treatment plan and I'm given a med, even anxiety, I can go and deal with it right now and I walk in Downtown Eastside. But you try to get me on safe supply, it's up to a doctor whether they like you.
As the toxicity worsens, she says the need for access to clean supply has never been greater.
Drug use is killing people on the street. We need to understand that every single person on the street is a person worthy of life. They're worthy of safe supply. They're worthy of not being saved because they're actually empowered.
In Vancouver, Ashley Burr, City News.